so much for that awesome presentation. Because time is of the essence, I'm going to introduce Denine Rogers. I just found out a few minutes ago she lives in Georgia, y'all, so she's a Georgia peach, y'all. All right. She's a dietitian, and she owns her own business practice, and it's called HEPSA, which is, what does that stand for? We don't know, but she's going to tell us. So anyway, Denine Rogers is going to come up and tell us about integrative health counseling and educational practices that we can use in our life so we can be healthy. Okay, thank you.
Good morning, everyone. Let me just quickly set up. And again, my name is Denine Rogers. This thing's okay. While you're doing that, my name is Denine Rogers. I'm a registered licensed dietitian, and I am part owner with my husband here, Steve Rogers, of the National Health and Public Safety Association, which is HEPSA. And I am part of the nutrition part and the health part, and my husband is part of the public safety part. So we were able to combine each other's businesses. So he basically protects people, and I'm the one who heals them. So.
I like that.
That's the gist of the whole thing, okay. So let me put this up. All right, and I want to thank everybody for being here. I do want to thank Martina and NOBEL staff and everyone for inviting me. I definitely want to thank Avid Nutrition and Maria Cahill. Maria raises her hand. She's not shy. And I also want to thank Laura Newberry. Unfortunately, she's not here today. She just delivered a little one recently. So I do want to thank her also for inviting me. And I also want to thank my little entourage of my mom and dad. They're from Tampa, Florida. So Florida, they are here to represent you also. So I just want to thank you so much for inviting me this morning. I do want to let everyone know that a lot of the information that you have in your packet, including the PowerPoint presentation, is right here, is in your bag, so you're more than welcome to look at it. And plus, you also have a lot of great information from Avid Nutrition. And you also have the handouts that's in your bag. So if you want to, you can take out the handouts. These are 2 pages right here. So then you can look along with me really quickly while I'm going through the presentation. So I just want to let everybody know that. Okay. So let me try to get this. So let me just show you how to use this clicker. So hopefully I am going to be doing this right. All right. So, okay. Oh, and of course I blocked it. All right. Okay. For some reason. Okay, here we go. All right. So today I'm going to be discussing malnutrition, but this will also entail the information from our previous speaker discussing about food deserts. So you're probably asking yourself, what is malnutrition? Well, malnutrition is a condition that results from eating a diet in which certain nutrients are lacking or in excess or in the wrong proportions. So in other words is that, let's say you ate potato chips. That is a particular food item, but what kind of nutrients does it have? Do you think it does have a lot of nutrients that's going to help you in order to work out for the whole entire day and help you up? Well, you'll see later on when we go into this presentation, not eating potato chips for breakfast is not a good thing. Okay. Even if people do get enough to eat, it doesn't mean that they are receiving the proper nutrients that they need. Most of us associate malnutrition for those who are emaciated, meaning thin people from other countries. So usually when we think about, what's going on with the famine, we think, okay, that person's malnutrition because they're thin, they don't have all the nutrients because they don't have food. Well, I want to also tell you that overnutrition caused by overeating is another form of malnutrition. So malnutrition is not just only for people who don't have enough to eat, it's also for people who do have too much to eat. So what you want to do is find out where your proper nutrients is coming from. Okay. I want to touch on the fact that nutrition is so important, particularly oral nutritional supplements. On this specific case study, which the hospital clinical outcomes, this health economic study demonstrated that oral nutritional supplements provided during hospitalization were associated with a decreased length of stay and lowered the actual cost to treat patients during hospitalization. All of the outcomes decrease when malnutrition was identified and nutritional therapy is administered. So you can see that the fact is that once nutritional therapy is administered for the specific patients, the malnutrition was basically done. Basically, we were able to treat the person. And also, as you can see, the positive results of including oral nutritional supplementation has shown when oral supplementation was added during the hospitalization stay. Right. Okay. So, what are the financial cost benefits of adding nutritional screening and intervention? Well, some of the benefits, according to the Academy of Nutrition and Dietetics, for every dollar spent on nutritional screening and intervention, at least $3.25 was saved from any unnecessary further treatments. If we do nutritional intervention and screening, we can save so much money and not having all of our patients that are going through malnutrition to be staying in the hospital for such a long period of time. We'll be saving so much money on hospital costs, so much money to be placed back into our own communities, and that's why education is so important. Now, I put up this specific case study, and I know this is also in your packet about the case study, but this specific case study is dealing with a person who's in our community as of right now. It may be someone out here, or it may be anyone that you may know. One of the things is that this specific lady, her name is Sheila. Like most of us, she is a wife, a mother, a caregiver, an income provider, a meal provider. Basically, she's basically everything. So she is a very, like what we call superwoman. And she works very long hours at work and even takes work home with her. She frequently skips meals, purchases nightly fast foods for the whole entire family. She doesn't cook because the fact is that she doesn't have any time, nor does she have any time for her own self. She doesn't like to drink water. You know, a lot of us like those soda drinks because of the caffeine. She does too, and sugary drinks. She's been gaining a lot of weight and experiencing constant headaches all of the time. Her blood pressure is elevated. She doesn't like to exercise because she don't want to feel like messing up her hair. And you know, on top of all of that, her family lives in the food desert, so tying into our speaker, in the inner cities of Atlanta. So there are food deserts, a lot of them in the cities of Atlanta, inner cities of Atlanta. And unfortunately, the closest supermarket is about 10 to 20 miles away. They do have a little, what we call New York bodega, which is basically a hole-in-the-wall supermarket which nothing is in there except outdated foods and basically no fruits and vegetables and other nutrients. So she really doesn't have that much of a selection of where she is. On top of all of that, she has a big family. As you can see, she's with her wonderful husband, Carl Sr. He is a father and a husband, a provider, but unfortunately he's not been a provider lately because he's a construction worker. And due to the recession, his hours have been cut. And in turn, the whole family is falling behind on bills. Carl Sr. also has a lot of health issues, such as his wife does too. He's decided to cut back on his medication in order to save money. Even though he's at home more often, he does not know how to cook. So, of course, he cannot provide the nutrients that the family needs from food that they should be eating. He relies heavily on Sheila to complete the all-to-date tasks at the home. So, you can see Sheila got a lot going on for her. But, on top of that, Sheila has her mother, Essie. You can see Essie right over there. Essie is an 85-year-old woman who recently moved into the family home because she refuses to go to the state nursing home. She said that she doesn't want to feel like being with other old people, and she wanted to stay with her grandkids and the rest of the family. She receives his funds from Social Security, and that Social Security, unfortunately, is not covering all the expenses to help the rest of the family. Sheila and her husband has applied for assistance to support Essie, but we're told that they were making too much money to qualify for any financial assistance. And Essie also does have a lot of health issues. She has heart disease, diabetes, and including malnutrition. Essie has been eating only 2 meals a day, and she also has been skipping breakfast. And she cannot cook herself, because even though she knows how to cook, because of her poor eyesight. Now, another thing also that Sheila has is 2 children. One is Ebony, who's a daughter. You see right there. She eats mainly school lunch because nobody else is able to cook. So she basically gets her meals from the school lunch program. And as you know, with the school lunch program, kids her age, she's around age 13, and they can choose whatever they want. But unfortunately, she's choosing the unhealthy choices because that's what she's eating at home. She eats large amounts of junk food at snacks, and she's been gaining a lot of weight, 20 pounds for the past few months. Yes. And the last person is Carl Jr. He's the older son, basically the oldest son, basically. And with Carl Jr., he really wants to get a basketball scholarship because he knows that his family is struggling for a lot of financial problems right now. So he may not be able to go to college. So in order to get a basketball scholarship, he definitely has to be able to practice and play. But the problem is that he is on injured reserve. And the reason why is because he too is eating poor nutrition stuff, foods basically, and it's basically causing a lot of problems with his injury issues. So one of the things that you can see right here, what assistance can Sheila receive? What about Essie, Carl Jr., Ebony, and Carl Sr.? What help do they need? What can you do to assist them? And what can you do as a legislator to assist them? Okay, so since this conference is about empowering, we want to try to get them to empower their lives by making healthy nutritional choices. Now, the first thing is that we're going to start with is the kids, the teenagers. And with the teenagers, the adults are the gatekeepers of the food. And they control the availability of food for the teenagers. But the teenagers' food intake is determined by their environment. So if these children are only receiving fast foods, that's what all they're going to be eating. They eat with what they have, and they choose with what they have. So what the adults must do is try to encourage the teens to make healthy nutritional choices. But the adults need to make sure healthy choices first, because a lot of times, some teens, they do follow what their parents is doing. So if the adults make healthy nutritional choices, they can make better lifestyle change and decisions. Now with Essie, as you can see, dealing with the specific acronym, which is determine, this is the key factors of predicting malnutrition in the elderly. So as you can see, determine, the first thing what you want to do is look for what kind of diseases does this specific person has. If they're eating too poorly, if they have any tooth loss or oral pain, what kind of economic hardships that they're dealing with. Do they have a reduce of social interaction? Are they taking multiple medications or involuntary weight loss gain? Do they have a need for assistance for self-help? And if they're also over age 80. If a person who is elderly that have all that, they can be diagnosed with malnutrition. And as you can see within this case study, Essie had a lot of these factors. So what you can do is that you can definitely treat her, because now you know, okay, she has malnutrition, let's give her the proper nutrients that she needs. Let's give her the proper food that she needs in order to help out and try to resolve this malnutrition. Now, I noticed that NOBEL has resolutions on malnutrition, but as you can see on your sheet of paper, one of your papers that you have, that these are your resolutions that you do have, and these are some of them on the wall, basically on the street. But are these resolutions of malnutrition being carried out? Are we spreading the word about that malnutrition is a big epidemic in our communities? And what are we doing about it? Yes, there are some sources of support, but the problem is that these sources are not focused on malnutrition. They mainly focus on obesity. So some people cannot qualify for these types of sources. So what do we do to help these specific people to get the resources that they need, get the food, get the nutrients that they need in order to help out through their malnutrition? Well, what are the solutions that we can do? Some of the solutions is education. Whoops. By promoting customer education programs on malnutrition, we can promote also Malnutrition Awareness Day. If we educate our people about nutrition, the proper nutrition, and that malnutrition needs to be in the forefront, then we can definitely prevent malnutrition from occurring. Now, I do have this wonderful orange ribbon, and I will, at the end, I would love to give everybody out the orange ribbons, because I do have some more. But this orange ribbon stands for malnutrition awareness. And this will be a great way in order to start a talk and a discussion with others, because people can see, oh, what's the orange ribbon mean? Well, this orange ribbon means that malnutrition is very, very rampant in our community. So what are we going to do about it? Let's talk about it. This will lead in a great discussion on what we can do in order to talk about malnutrition and getting it out of our communities. This can also allow, as you guys know, that you do have a malnutrition resolution. This can also allow you to discuss about what the resolution that you have. So this could be a really good lead-on discussion. So, give everybody that. Okay. So other things that we can do as solutions is supporting advocacy programs that are customer, community-based, that include nutritional links to help out with malnutrition. One such program is the Open Hand in Atlanta, Georgia. And the great thing about this program, which I have visited and I have volunteered with them, is that it provides comprehensive nutritional care that combines home delivery meals and nutrition education from registered dietitians. It serves the lower-income community, also for homebound seniors, and it supports over 4,000 meals per day. So having those type of programs in our community can make a big difference. Also, why not educate a lot of the local supermarkets or the local quote-unquote bodegos and educate them, hey, we need these types of healthy foods in our communities. But the thing is that we also have to educate the people, because the people, the supermarkets there, the bodegos are not going to sell these type of foods if people are not buying them. So if we educate our people in our communities about these are great food selections that we have here, these are ones that are going to help benefit you in the long run, then this can definitely help the bodegas and the other supermarkets in the area to start bringing those types of healthy foods in the communities. So in conclusion, I want us to all come together, to work together, to build a plan and to spread the word about malnutrition prevention. And if we can do this, then we can definitely, hopefully, one day to eliminate the food deserts in our areas and to bring healthy, nutritious foods in our communities. And this will also, in turn, will prevent any further malnutrition from happening not only within ourselves, but also within our families as well. I thank you so much. And you're welcome to speak for me later if you want to. And it's free, it's free.
I'll take this.
If you all would help me thank the keynote speaker and our presenter for all of the great information in which they have shared with us today. This information is very vital to a prosperous and productive community in which we all serve. So let us take that information and share with our other colleagues as well as other leaders and community leaders in our respective areas. After a few words from our national president, Representative Hall, we will move on to our next set. She says move on now. So this concludes our breakfast. I hope you all have enjoyed. Please know